for a little bit longer. We will be speaking about our program, and this is our second time running it, so some of you may be familiar with the program already. So we'll talk all the way through some of the program rules and eligibility guidelines. Really just want to answer your questions and a lot of questions that have come up, which brings me to the interactive feature of today's presentation, where you can submit any questions that you might have throughout the course of the presentation, and our geniuses over in the marketing comms department will be answering those in real time. And then if any questions go unanswered, we can get to those at the end of the presentation. Shouldn't take the full hour today. We'll go through some of the content, but again, we'll try to answer as many of your questions as we can. So we'll start off first just with how today is going to work. We'll talk a little bit about who we are, what the Spark program is all about, who can apply to Spark, what are the types of projects that qualify, what are we looking for, and what types of projects are not eligible for this particular call. We'll talk about our eligibility and evaluation criteria, how these submissions will be scored. We'll talk about some of the program dates and how those reflect the process of applying to Spark. And then we'll get into these FAQs, some of the questions that you've submitted since the call went live. And I should mention right off the bat that this is a live call for innovation. So this is, if you check out our website, CABHI.com, you'll be able to find the submission form. The expression of interests are due on October 11th. So it is a live submission window right now, and we're hoping to get as many submissions, quality submissions from you and from people in our network. And so we've already seen a lot of submissions rolling through. So please get started on a submission today, and feel free to reach out if you have any questions. So let's talk first about who we are and who is the Center for Aging and Brain Health Innovation. So CABHI is a solution accelerator in the aging and brain health sector, providing funding and support to innovators for the development, testing, and dissemination of new ideas and technologies that address unmet brain health and seniors' care needs. So we were established in 2015 and are the result of the largest investment in brain health and aging in Canadian history. And we represent a unique collaboration of healthcare, science, industry, non-for-profit, and government partners whose aim is to improve quality of life for the world's aging population, allowing older adults to age safely in the setting of their choice while maintaining their cognitive, emotional, and physical well-being. And so one of the major ways that we do that is through these competitive calls to innovation. So Spark being one of them. For those of you who've heard of I2P2, RCP2, KMP2, we've also launched those programs in our initial year of having competitive programs, and through those calls we're able to assess and screen submissions that we eventually go towards funding. And so last week, for those of you who follow us, we had a large announcement for a number of 26 projects actually through other programs that were announced. So we're constantly rolling out these programs, and so we'll talk today about Spark, but just a note to keep your eye on our website for any other new innovation opportunities that may come about. So let's talk about Spark. The Spark program is essentially for small-scale grassroots innovation activities that are conceptualized by point-of-care delivery staff, currently supporting healthcare delivery for seniors. And so what that means is we're looking to the people on the front line. So we're looking for nurses, physiotherapists, all clinicians, social workers, the people who interact with these seniors on a day-to-day basis most frequently. We're turning to those people to come up with solutions that can have real impact on our senior population. And so a lot of the discussion that we had in coming up with this program was that there's a lot of ideas that exist on the front line, but they're not given the opportunities, or they historically haven't been given the opportunities, this population, to enact and to activate some of these ideas. So that's really what the Spark program is all about, is we're offering up to $50,000 for Spark projects to accelerate the development of innovations that will help improve brain health and quality of life for older adults, with a total of $1.25 million available. You'll recall last year we funded 31 projects in our initial portfolio. We'll be looking in and around maybe 20 or more, depending on how the different asks come for. We'll fit in as many projects as we can afford in that envelope of 1.25. But really just to hammer home, the whole concept of this program is to give the opportunity to the people who have been resourceful and dedicated and creative for years in assisting seniors in the scope of their duty, and these are the frontline point-of-care professionals. And so this program is all about giving them the opportunity to do something a little bit outside the box and to innovate, and providing them with financial as well as other types of supports that allow them to do those kinds of things. So who can apply? We touched on it already, but any point of care or service staff worker associated with healthcare delivery or service provider organizations. And so that can include a number of different types of professionals, so healthcare professionals, allied health professionals, personal support workers, certified nursing assistants, support staff, and home care aides. And so again, what makes this program exciting is that we're looking to these individuals to lead the projects, to take an ownership of their own ideas, whether they've been coming up with them throughout the course of a number of years, or if these are things that have never really left their mind before, and this is the first chance for a point of care staff to put an idea onto paper and to work through the process of innovating and taking something kind of from the idea stage into really testing and making an impact with the senior care population that they work with. So if you have any questions about whether you yourself or someone you know who is interested is eligible for this program in particular, please utilize the chat feature now, and you can ask a question specifically about your situation, or you can again email us at info@cabhi.com, and we will come up with a specific answer to whether or not you're eligible for this particular call. So now we'll talk a little bit about some of the eligibility and how that kind of operationalizes. And so one of our goals at CABHI is really to provide solutions to some of the biggest challenges facing older adults in our community today. And so for the purposes of Spark, we want to focus your efforts on the theme of dementia. And therefore, we're looking for solutions that have the potential to create meaningful change in one of the following 4 areas. And so we'll walk through these 4 areas. So first, we have aging in place. These are solutions that enable older adults with dementia to maximize their independence and age in the most appropriate setting of their choice. So again, the most appropriate setting doesn't necessarily have to be at home. It could very well be at home, but the whole idea is that these are solutions that give older adults a choice in terms of where they want to live their life and how they want to live their life. And so these are solutions that could be remote home monitors or other like things that just give that opportunity and that empowerment to older adults to choose the setting where they're going to age. The next category is caregiver support. So this is a new theme for us this year, and these are solutions that support caregivers, both formal caregivers and informal, in their care for older adults with dementia. So these types of solutions can either be program-based. We've had some concurrent program offering type innovations that allow seniors with cognitive impairment and their spouses who are undergoing normal and healthy aging to participate in activities together, and in turn that supports the caregivers, allowing them to reflect ideas off of each other, just to give you an idea of a type of solution that would fit into that category. Care coordination and navigation. So these are solutions that assist older adults, caregivers, and healthcare providers to better coordinate and navigate care for older adults with dementia. So it's a confusing system, as we all know, out there to navigate at the best of times, and so you can imagine how that can certainly get more difficult if you've just been, if you've just received, or someone you love has been given a diagnosis of cognitive impairment or dementia or Alzheimer's or some like cognitive impairment. So having the ability to innovate and coming up with new ways to help these individuals coordinate their care that they're receiving and navigate through a very complex health system is a very high priority for us, and that's one of our solution themes this year. And finally, cognitive health. So these are solutions that can both improve as well as just to identify brain and cognitive health issues for aging adults. So again, we're supporting the identification and assessment as well as the improvement of cognitive health issues in this theme. So there's a lot of different types of solutions that can fit under this umbrella, and we like the way that it's come at a number of different angles before, everything from virtual reality to apps to program-based innovations. This is an interesting category, and so any of these 4 solutions, they're all weighted equally, but they're the 4 solutions, and so we'll get into the eligibility and how that works, but these are the solution themes that there has to be some clear tie-in in your Spark application to one of these 4. And so again, we'll talk now about the eligibility criteria, specifically the solution criteria. As a first point, it must address one of the 4 themes that we just mentioned. The host organization must own the IP associated with the solution or substantially contribute in some way and retain some of the benefits. So this is a little bit wordy, but what it really means is that this is for point-of-care staff who are working at a healthcare organization or one of our eligible institutions to come up with something that belongs to the institution, as opposed to bringing in a solution from an external vendor or a company to test it. That's more of a different program that we have, similar to the I2P2 program. Spark is really for the grassroots innovators to come up with solutions on their own and take them through the stages of development within the host institution. The last point, and this is a little bit fuzzy, but I think you'll understand what we mean, is when we say it has to be innovative. And so innovative doesn't really have one definition in the industry, but what we're really looking for here are solutions that deviate from the norm a little bit. So quality improvement is kind of a logical progression from what has occurred in the past. Innovation is kind of a bit more of a jump, and so it can exist in forms of quality improvement, but what we're looking for are maybe ideas that are a little bit different than what already exists. How does this translate into practice, but doesn't come from somewhere else, or it hasn't been adopted widely, and your institution is just trying to catch up or trying to adopt a different solution? We're looking for novel and unique solutions that have a disruptive potential in the health system. Talk about some of the applicant eligibility. So the lead applicant has to be a point-of-care staff member working at an eligible host organization. We talked about that. So again, what this means is that there has to be some level of regular interaction with the lead applicant and an older adult population. The host has to be the one that receives the funding, so it would go directly to the account of the host institution through CABHI, and it would be received there, and then it would just be up to the management there how to allocate the funds based on the budget that you submit in the full application. So it would be received by the host institution is what needs to be taken away from that. And so different types of host organizations that can apply, or that project leads can apply out of, are not-for-profits, healthcare organizations, not-for-profits with a mandate to serve older adults, people with dementia, or a member of the SQLI. And if you're not too familiar with what the SQLI is, it's a network of partners that we have both in Canada and the United States. So that is how a US organization can get involved with this program. If you're not sure if your organization is an SQLI member and you're from the US, then you can send us again a question and we can clarify what the list is. A number of American institutions have been a part of this program in the past through that partnership. And so lastly, some project eligibility. So the initiative has to involve some sort of translational research component or some real interactive component where we're looking to actually introduce an innovation to a target population, or to develop something that is intended to reach a target population of older adults. So we're not looking for basic research, primarily academic research, capital investment in a portfolio of IP, or pharmaceutical clinical trials, things like that. Eligible projects must focus on the development or refinements of early stage solutions, and the projects cannot exceed 12 months. So this is, again, a $50,000 award to conduct a 12-month or less project. And so we'll get into the evaluation criteria, but we'll first just I'll give you a sense of how this all flows from your expression of interest. So expression of interests are due on the 11th. So October 11th is the final day to submit your EOI. And after that is received by the Innovation Office at CABHI, there will be an internal screening just to ensure that all projects that have put something forward are eligible. After you have been given the green light and that your project is eligible, you'll receive the link to the full application, which will include some similar fields, but will be a little bit more in depth of an assessment, and we'll be providing those submissions to our external review panel, who will be looking at 5 different criteria that I'll walk through right now to understand how those different, and they'll be given instruction as to how to apply those different criteria and select the top projects to be considered for funding. So the first theme here, the first criteria, is strategic alignment. So just looking at how well it aligns with our themes, the 4 that I mentioned previously. How clearly defined and significant is the problem being solved? So that's the first point. The quality of the solution. So how effectively does the solution address the identified problem? Our reviewers are going to be looking for things like quality of existing evidence, how innovative and unique or breakthrough is the solution proposed. So again, not reinventing the wheel, looking for novel and unique solutions in this category. The third criteria is the market opportunity and the commercial merit, and this kind of gets into that whole thought of knowledge mobilization and knowledge translation. So what opportunity is there to disseminate or commercialize this innovation beyond the local context that it's being developed in? So is this something that is a strong innovation locally but doesn't really have that much scalability potential, or is this a thing that has demonstrated size and value in the market of a local institution and then can be a more broadly scaled out and thought of as a more of a dissemination project in the future? So we're looking for things, of course, that can affect our mandate, which is to help promising solutions spread and scale. So putting some thought into how you can frame your innovation, your innovative idea is something that can affect more institutions than just your own. Project goals, so how well planned and resourced is the proposed project? What outcomes and metrics is the project seeking to produce? These are the things that we're looking for more in the full application. You'll get a chance to touch upon them in the EOI, but really what we're looking for here is a project plan that demonstrates some real value for the innovation that is being awarded. So we're looking for, how does this project that you're proposing we invest in, how does this really advance the state of your innovation, and how does this really advance the state of care in older adults, more broadly speaking? So 4 is project goals. And the last criteria is the company and or team experience. So in this case, it would be the organization and team experience. So with a demonstrated track record of relevant successes, qualifications of the members of your project team, if you're trying to develop an application and you haven't identified where you're going to draw on technological expertise for, then that would be an obvious criticism. And so you want to make sure that all of the different levels of expertise and all the different subject areas are all covered in your application. And so that a reviewer who's reading through this saying they want to develop a new solution that's in this area, they would have to understand that makes sense because we have expertise in these different areas that cover the development of that solution. So that's what we're looking for in that selection. So just to give you a sense of some of the projects that we have invested in the past, just because this is our second time running it, and we can speak to some success stories from past recipients. So these are projects that, just for context, will be wrapping up at the same time that successful projects in this round will be getting started. So one of our 2017 Spark recipients includes Dementia Talk App. So this is a solution developed out of Sinai Health System by a clinician, and it's designed to kind of connect and empower dementia caregivers to track and manage challenging behaviors. So it has a whole bunch of different features, and I've seen the way that it's come together, which has been really, really promising and interesting. It has a number of different facets that allow you to log behaviors, that allow you to log medication lists, things like that. And it's a really interesting concept in that they've taken it to a place now where it's a really useful app that they're launching soon to come into the hands of caregivers to really track and manage people with dementia and the behaviors that they display. The next one, prescribing virtual realities. This is kind of a neat project that uses VR and exposes people with dementia to VR to reduce feelings of depression, anxiety, and stress, which a lot of the time lead to an older adult's desire to wander. So the whole study here was determining if this was a feasible solution, perhaps a replacement for a pharmacological intervention, something that's a little bit less invasive, and it can perhaps still give a lot of the same benefits that using a pharmacological intervention would give. So that was the nature of this study, which is taking place out of UHN. And Stronger at Home is the final one to talk about. So this is a cool program that started off as very much not tech-based. It was an in-home exercise program aimed at reducing the number of falls taking place in Stonebridge, Ontario. But what they found is that it actually had an opportunity within the project to scale that into a virtual offering. And so now they're building out their archive of videos and instructions, and they do a lot of web content, and they're looking to produce media and virtual videos that also help to scale and spread the whole concept of this exercise program. So again, it gets back to the KM or the KT idea of broadening and scaling different innovations after they've been proved effective in a local context. So that just gives you an idea of the different types of innovations that we've worked with in the past. I'll talk through now just how to apply. There's 4 simple steps. You want to visit our website, CABHI.com. You'll see a button at the top there, Apply for Spark. You can click that and read through the information package. There's a lot of details that I haven't gone into today, just for the purpose of giving you a high-level overview. But essentially, you'll be able to read through and understand what types of projects we're looking for, what types of people are eligible, some of the things I mentioned today. And again, submitting an expression of interest by 5 p.m. on October 11th is a requirement to be considered to submit a full application. So again, just submit something that gives off an idea of what the full application or what the full project will look like. These are going to be sufficiently detailed to understand the eligibility, but not to the point that we need, that it would be a fulsome project plan with a whole budget attached. That's not the level that we're at. We're just looking kind of for the concepts to make sure that you're in the right direction. And so then we'll provide some feedback as to whether you are. And if you are invited to submit a full application, those will be due about a month later. So we'll get back to you. One date that's not there, and I think it's in the next slide, is that on October 18th or 19th, we'll be responding to the EOIs that have applied, and we'll tell them if they're eligible, and they'll have about a month to submit that full application. So I'll click now just quickly on the actual EOI form. Oh, cannot download. Bit of an issue there. There we go. So this will pull up the Blitzen form, and so bakerus.blitzen.com/form/spark2017. This is the form site that we use for all of our calls, and so you can scroll through and check out some of the questions that we have for you to answer. Just includes a lot of demographic information about your host organization, and then it gets into the solution. So come up with some sort of fun, unique name. Maybe call it Rocket Shoes. It's a great idea. And solution type, you want to talk about what the solution is, give a quick, brief description, talk about why this is innovative, does this exist elsewhere, and again, you're just trying to give us a sense of what you want to do with the funding if you're successful. You'll be able to explain a little bit more in detail in the full application, but just give us a sense of what theme does it apply to, what is the project that you're trying to do, is this, you're going to do a pilot testing and development, obviously a little bit more detailed than that, but just explain what you're really trying to do, how much funds are you requesting, maybe the full 50,000, and then at the end we just ask you to explain how you hear about this program. So it's a very simple form. It's only 17 questions. You can save your progress on the form, and that'll generate a unique URL at the top. And so you can copy that URL, and if you're working with a number of different people on this application, you can share that around to your different team members, just making sure that only one person is updating the form at a time so that you're not going over each other's work. But it gives you an explanation as to how to save your work just in the text at the very top of the form. So for assistance, you can reach out to me directly. Any questions, again, you can forward to info@cabhi.com. But the big date here is October 11th, so please make sure that you get all of your submissions in before October 11th so that they can be considered to move on to the final application. So just some of the dates that we didn't talk about last time. So October 19th is the date that we will be letting you know if your submission has been accepted to move on to the next round. November 16th will be the final date to submit a full application. It'll look just like the form that I walked you through just now, but with a little bit more chance to go into detail about what you want to do in your project. And January 5th, we will be announcing with our internally to our projects that have been selected that they will be receiving their award and that they have been selected for investment. and we'll have the agreement signed by January 31st, and projects will start on February 1st. So please make sure when you're considering what the different project activities might be and who might be involved with them, all of these projects are a maximum 1 year long, and they have to start by February 1st. So that's just one of the restrictions on how you're going to plan for your projects. So we'll now get into some frequently asked questions, and we have a couple of questions that have come through over the past few weeks of having this call open, as well as a couple that have come through live as we've been doing the webinar. So first question we're getting, this is from Steve in Moncton. So Steve is asking, can I submit multiple applications? So it's a good question, Steve. Absolutely, yes you can. We only ask that you submit one unique application per solution. So you can't stack the deck in a way that you're submitting multiple applications obviously for the same thing, but if you have multiple ideas, you have multiple projects you want to work on, you can apply for as many as you like. There's no limit to how many one institution can submit, and submitting one by one institution does not limit the chance of that institution receiving 2 or 3. It's all totally open. So we hope to receive as many submissions from your institutions, and there's no penalty for submitting more than one. The only caveat is that in the case that you are wildly successful and that all 5 of your submissions are accepted, you must be prepared and equipped to carry out all 5 of those projects. So you can't at that stage then decide I only want to do 1 or 2 projects. You have to be able to carry out as many projects as you submit a full application for. But in your EOI, if you want to submit for as many ideas as you have, then feel free, and again, just no penalty will be incurred by any team that submits more than 1 application, as long as they're different projects and different solutions. So next question we're getting, this is Dave from London, Ontario. Hi, Dave. Can I apply to refine an existing solution, or does this have to be a new solution? So the answer to that question is yes, you can apply to refine an existing solution as long as it is pre-commercialization, pre-adoption, and you're still in the early stages. You're not working with a commercially available solution at this stage. You're looking to refine something that's very early on in its development. Because Spark as a program is really looking to bring these ideas to life. So if something's at too far of an advanced stage of development, maybe something T8 or T9 on the tech readiness level scale, that's probably outside of the scope of what we're looking for in this program. So if it's refining and kind of taking an approach to enhancing an existing solution, that's probably fine as long as it's pre-mass adoption. Another question we're getting here, I am a manager with a clinical background, can I apply? So yes, the answer is yes. Point of care staff are the audience, so if you have a clinical background, even if you're not currently working in a position, say you're a nurse practitioner and now you have been promoted to a director of nursing, or you're a manager of research or something, that's totally fine. Just to make it easy on us, make sure that you include your clinical designation in the form when you're submitting under work title. We'll just ask what your point of care designation is. You can maybe just put in brackets clinical background as a nurse or as a physio or something like that, just so we know that you are eligible as based on your work title. I think we have time for maybe one more question here. So what else comes with the Spark Award besides the funding? Okay, so yeah, this is a good question, and for those of you who've kind of been in our first Spark cohort, you're aware of the advances we've been making in trying to build a little bit more of a suite of services around the funding, and so it's not just the funding that we provide, but we're also we've built capacity, and we're excited to soon be announcing a number of project support services in the areas of project management, exclusive event invitations, supporting commercializing, knowledge mobilization. If that's your end goal, is to disseminate this and to mobilize the practice or innovation across multiple sites, then we do offer supports to help you in achieving that goal. One other cool thing that we have access to is a seniors advisory panel, which we've been very involved with, and they provide us a lot of direction in the types of solutions that we fund and what we do with them. and we'll help you get in front of them, and you can actually speak to this group of end users and people who have an understanding either through themselves or a loved one or caregiver of what it means to be an older adult and what types of solutions can really benefit them. So if you're looking to refine and take kind of a focus group perspective on your solution, then we can help you get in front of this group and get some really, really comprehensive feedback on what might improve and enhance your solution. So I think we'll draw things to a close there. Again, visit CABHI.com, our website, to apply and read a little bit more information. If you have any questions that weren't answered today, you can reach out to myself. My email is listed on the form on Blitzen, or you can send an email to info@cabhi.com, and our team will get back to you as soon as they can. As a last point, I just want to say that we're very excited to be launching this program again, and we hope to get many applications. It's really been exciting to see a lot of people who have not been given the opportunity to come up with these types of solutions in the past to bring them forward. And so we encourage you to reach out to your networks, to reach out to your colleagues, reach out to people who you know who are innovative and have a lot of ideas, whether you've just heard them in passing at the cafeteria or if you've heard them in a little bit more detail. This is a really good opportunity for point-of-care staff, people who are working on the front lines, to really take these ideas that they're coming up with on the daily and to put them into practice and to bring them to life. And so, again, reach out with any questions. We'll be excited to see your applications, but we'll bring things there to a close. So thank you again for joining us, and stay tuned for more updates.